quality and service through animals grass-fed and bred especially for their meat. This makes the meat much more tasty, succulent, tender, and easy to cook. All meats at Majalik Butchers are halal, including for the first time in the Gambia, the new Mongolian whole lamb, available only at Majalik Butchers. Rush now and visit Majalik Butchers on Caraba Avenue, opposite the Petrogas petrol station traffic lights. For inquiries and orders, please call 7688-688. That is 7688-688. Majalik Butchers, the home of quality meat and chicken products at unbeatable prices.
Domoro kadiate
boy janno sikes restaurant
e say nakko be ninna dimbal nimba domoro kala janno
domoro seneyata adiyata topotoro fanan kendema bije luntan during tamala abeka domoro ki janni adi manda wala de teka we bijele anim fanan ka fadi jang ikono e fa e ka fa minne ko pastry anim bakery iko fanan be kalele badde lomba conference lomba workshop lomba ye fo fendil lo dunia kono domoro betama nyillom international otoda number 1
amanke ba domola jandama
e sa domo jang is atariya
wo mu kubandi
sa nakko sa futandin
e oto sa nakko be mu sikes restaurant
ndafa na jannamu yat ni manje dorom bijam
aban
CK's Restaurant, known for best quality food and customer satisfaction.
diwli lanni maro lanni
fop lanni
awa jodi mi anda honno gerde ten e ngaldo sabu e ngaldo Ibrahima jonnal taw joni mi anda se yahay kapitiki nyawlo den ha humpondire makko est ce qu'on non e warude
waden no awa
ane ko Ibrahima mo ko to woni
mo Amerique
ko Amerique a woni kede humpitaki fi be musibe men baluwo be andanda kala ko wada wonde aduna si arrivi e juude mabbe a jonnay do dépassement Gambia har no weebi ayata kadi taw ko mbudi din no jawi walla no jippi be halantama ko kala ko falda ko reise sengo nyamete ili neppa maro basal pomme de terre kala ko rewi don a hendo to har no weebi kadi wona ɗum ɗon tu ɓe aɓe jonnira e mobile phone siko ɗum kadi laptop kala ko wayrode ɗi hay kasbawa ɓe wawma jonnude kadi sa fala humpitade ko weeɓi ƴetti google account ma joni data ton waɗa download app maɓɓe on ayi kala ko humpima e maɓɓe ton ɓe weeɓiyama
ka wonɗa wo e aduna on
kala ko wawɗa
a jonnanayi wonɗo ka leydi men Gambia ɗo dépense
hara no weeɓi ha ma si ɗum non fof no neeɓi immoɗen joni mi ɗowtama ka place maɓɓe jan
waɗen joni
iya heɓa ko falaɗa
waɗen kisam.
When we touch down, better broke down.
With Gamtel G-Fiber, now you can enjoy super fast internet in gigabytes. G-Fiber is affordable, stable, secured, and accessible to homes, businesses, and enterprises. With Gamtel G-Fiber, the future is speed. Gamtel, creating a brighter future in communication.
That's how she became mine and see the
In communication, connectivity is everything. We ensure that the links never sleep. Quantities and qualities, all in our data service, providing efficient, reliable voice and data service. We believe if you're not up to speed, then you're going backwards. Communications have to flow as fast as the speed of light. Whatever business you're in, having someone who understands your needs is critical. That is why we just don't offer you technology, we offer you solutions. Enjoy Gamcel's internet broadband anytime, anywhere. Your national operator, Gamcel, Yaibaram.
I get it.
Mbijan aganyani.
Albaka.
Mbaka important.
Yo, nga transfer la sto.
Ya transfer la.
Ha, code nyingi.
Okay. Important. Nsila ID soto.
Sa soto. Sorry. I get it.
Mbijan bro.
Albaka.
Mbaka.
Bara alla service o tariaka.
Mbare.
Mo ki janna nun kunu bara tariaka.
Jannom yona forest de bureau. Gambia tonkon na no mbali ya bere. Birim koyna fo katon.
Bari si kodo kino katon nim fo bolong blabe to.
56 branches mola soto Gambia jam.
Ha?
Gambia kono ani Gambia bantala bankol. Nka kodo kiya bere to. Kodo sifa fo falindiro fo nyaadi lafta memmen na kodi to poto nin kodi maraw. Jannom number 1 ti nyonta. Andum fana nata anoda enterprise sotale. Golam nyindi ko domorol fana kol fana be firale le dadi ma ni domorol ni fana beteata. Gambia dawda yalo nga fa kendol sotale je.
Wo moyo diat.
Apelenta
baraka. Ni ma lafta nyelen kendol e bina.
Yalo bukani la ko la baraka ba.
Yalo ndel chosano lo.
Baraka.
Are we ready to start?
Honorable Judges.
So we can start now.
How are you all? Good, well done. Thank you.
Are we ready to start? Good evening to all of you. Honorable Dr. Ahmed Lamin Samate is also here again to give you an update. As usual, what we have been doing to ensure that whatever we are doing with regards to COVID-19, the Minister will just come and give you an update. So once again, thank you, our colleagues from the media, for always being on our side since the start of the pandemic, way back in January to now. So we want to thank you for all the effort you have been doing on behalf of the ministry and on behalf of Honorable Dr. Samote. We want to say thank you for all the support. And I now have the singular honor to invite Honorable Ahmed Lamin Samate to come and give you the statement, the press release with regards to information to update you as to what is happening. Honorable, welcome.
Thank you, Martin. Well, you want no space for my paper. Thank you. Yeah. Good afternoon, ladies and gentlemen. The 22nd National Situation Report since the confirmation of the first case of the novel coronavirus disease, COVID-19, in the Gambia on the 17th March 2020 reveals the following. 1. 4 people who sneaked into the country through the land borders were found through a community tip-off to the 1025 hotline and have been taken into quarantine. Sites have been secured for makeshift COVID-19 treatment centers in all the health regions in the country. Western 1 and Western 2 health regions continue to register the highest number of calls to the 1025 toll-free hotline. The 4th case that has been diagnosed in this country is still on admission and is responding to treatment. A total of 76 new laboratory test results have been received recently. 5 were positive, 1 inconclusive, and 70 were negative. 2 of the confirmed cases were in quarantine and later on home isolation on account of recent travel from the United Arab Emirates. 1 other confirmed case was in quarantine and also later on home isolation on account of recent travel from the United Kingdom. The remaining 2 confirmed cases are still in quarantine for being close contacts of the 4th confirmed case. The inconclusive case also has a travel history of recently returning from the United Arab Emirates. Currently, the country has 6 active cases, 2 of which were locally transmitted. We have 2 inconclusive cases, 2 recoveries, and 1 death. To summarize again, the Gambia has recently registered 5 confirmed COVID-19 cases. Globally, since 31st December 2019 and as at 10th April 2020, a total of over 1.6 million cases of COVID-19 have been diagnosed, have been reported. Of these, there were over 100,000 deaths, over 370,000 recoveries. Senegal, our neighbor, recorded 265 confirmed cases, 137 recoveries, and 2 deaths. Currently, we have 47 people on quarantine in one of the hotels in the Greater Banjul area. A total of 200 A total of 281 tests were conducted and 9 were positive. 270 were negative and 2 were inconclusive. 253 people completed quarantine. 233 contacts have been traced so far, and 310 people completed follow-ups. With regards to the coordination, case management, logistics and security, laboratory and surveillance, as well as risk communication and community engagement, the following activities were carried out: daily coordination meetings, ongoing at both the strategic and technical levels. We are intensifying the conduction of laboratory tests for a wide range of people. Case management and infection prevention and control training of health facility staff, covering both public and private health facilities, ongoing, and the provision of regular psychosocial support for people in quarantine as well. The 4th case is still receiving treatment and his condition remains stable. The 5 new cases have been taken to join him at the government treatment center. In the area of logistics and security, all the regions in the Gambia have received stockpiles of personal protective equipment. Risk communication and community engagement activities are ongoing and are being intensified. In the next steps, the Ministry of Health, in collaboration with partners, will intensify the following actions. We will partner with other stakeholders and communities to continue with the massive sensitization on COVID-19. We will follow up and provide continuous psychosocial support to the affected communities, persons under quarantine, people who have just been discharged from both quarantine and the treatment centers. We'll also continue daily follow-ups of low-risk contacts and those discharged from the quarantine centers as well. We encourage public reporting and self-reporting of high-risk individuals through the toll-free number 1025. We'll also be engaging inspectors of the State of Public Emergency Regulations 2020 and documenting best practices of compliance while identifying challenges that require urgent attention in the interest of public health. Finally, I would like to appeal to the regional governors, to the district authorities, the ward development committees, the councillors, village development committees, religious and other community leaders, heads of women groups, heads of households, and family members to be very vigilant and ensure the full implementation of the suspension of public gatherings in whatever form, and to ensure the practice of social distancing. This strategy will certainly help us reduce the spread of the virus in our communities, and this becomes more relevant now that we have started to register local transmission. I would like to conclude by commending all the communities that established and support the work of the community vigilantes in tracking people entering into the Gambia from affected countries and communities along the borders. The Ministry of Health salutes this important community initiative and will urge all communities in the country to embrace and establish such community COVID-19 monitoring structures. Community participation and involvement in the COVID-19 interventions is essential. Together we can make a difference in our efforts against COVID-19 in the Gambia. Once again, I thank you very much for your kind attention.
Yeah. Thank you. Now we invite Sankano to lead the facilitate the question and answer session.
Good.
Go on.
Thank you very much, Honorable Minister of Health, Dr. Ahmad Lamin Samat, for that important update. Members of the media corps, the floor is now open for questions. Your name and your media institution and question, yeah? Yeah.
Good afternoon. My name is Sugayagi from Gambia Times TV, and I want to know why the sudden change, because we have not been registering cases for the past 2 weeks now. So why the sudden change? We have 5 cases.
Okay. Honorable Minister. Thank you.
Well, this is the epidemiology of diseases. They have various epidemiological patterns, how and when they present, which is usually not under the control of the health personnel per se. But looking at the pattern, looking at the incubation period, and looking at when we started registering the cases, we had been anticipating an increase in the level of the cases based on this particular epidemiology of this disease. If you look at what happens in many other countries, 3 to 5 weeks after registering their first case is when they saw the explosion of cases. In most countries, that's what happened. That is why we had been singing the song of Gambians not being complacent just because we had 4 cases. We should be aware that COVID-19 is a reality, and this is actually the time when other countries who have had unpleasant experiences with COVID-19, this is when they started seeing the exponential increase in the number of cases. So this is why we should still practice, continue to practice the sanitary habits, the etiquettes of coughing and sneezing. Equally, the social distancing, we should emphasize that. Social distancing is very important, especially now that we have seen that we have started to register locally transmitted cases.
What I want to ask is, is there any connection between these 5 who are infected, or are they from different backgrounds? Because they are connected, maybe one can think they are transmission from somebody who was having it infected. So are they from like a connection that?
Yes, yeah. Thank you. As we said earlier, 2 of them were close contacts of the 4th case that is currently under treatment. So we believe those are locally transmitted cases. The fact that those 2 do not have a travel history, but they live together with the 4th case in the same compound. The other 2 also came from travel from the same place, and they were all together, coming from the country where they were all staying in. And it is important to emphasize that these people are all Gambians, and it is also important to emphasize that they are all, most of them are young. 2 of them are 20 years old each, and the other 2 are 28 years old each. So we have 2 people 20 years old, 2 people 28 years old, and the other individual is in his 60s. Why are we emphasizing this? We are emphasizing this to let the young people know that young people are also vulnerable. We've seen in other countries it affecting more of the older people, but that doesn't mean young people are not vulnerable, and we should all be very responsible citizens, even if the young people withstand the disease. But they could infect people, loved ones, people in the communities who may not be able to withstand the disease. So it's our collective responsibility to make sure that we carry out what we need to do for the prevention of the disease, against the disease, yeah.
COVID-19, and as among yourselves here, they are not taking it seriously. In other countries, if you see the team that is responsible for COVID-19 on the TV screen, they are taking things seriously. But likewise in the Gambia, it's a different case. So what assurance will you give to the Gambian people that they should still have confidence in the Ministry of Health?
Well, I think maybe this is just your own individual view. This is the first time I'm hearing this. So this is your own view you are putting as you are representing the people of this country. So I think this is your personal view. But nonetheless, I will respond to your personal view. A lot of people have demonstrated confidence in the Ministry of Health of the Gambia for what we are doing. If you want us to appear here and put on suits to look serious, then I think you are missing the point. We are workers. We are running around between the quarantine centers, between the treatment facilities, building up new facilities, responding to the equipment needs of this country, talking to the people, following the people who are doing the follow-up. So if we are not wearing suits and looking as you expect us to look, then that is misleading. But I think by the virtue of the Gambians who are sending their congratulatory messages, their messages of support, their messages of solidarity, I think the Ministry of Health is doing very well. Now, compared to what is happening in other countries, the Ministry of Health started very early. We started earlier than most other countries. We started the follow-ups, the preparation earlier than most other countries. We started the response earlier than most other countries. And you will be shocked to know our proactive nature is what detected these cases. You know what would have happened in some other countries when people complete quarantine because they did not manifest the symptoms and signs, they would have been let to go home. And we insisted, based on our knowledge, and I think we are all happy that we have very knowledgeable people in this ministry to deal with such. But based on those knowledges that we have and the experience that the people have, we insisted anybody from the quarantine centers must be screened. So all these 5 cases would have been lost if not for our intuition, if not for our competence, if not for our educational levels, if not for our hard work. So I think that's why the people of this country know that COVID-19, there is a serious team that is going ahead with the strategies to deal with COVID-19. And going by the efforts, I mean, if a country that had 4 cases, you think that country is not serious. I wonder what you will say about the countries that have tens and thousands of cases with their strategies. Thank you very much. Yeah.
Now that we have started registering local cases of infections, the COVID-19, what is next for the ministry in the fight against COVID-19?
Well, it's to intensify what we are doing. You see, we are intensifying the follow-up, the contact tracing. Anybody who has had a link to these people are being followed up. In fact, as we speak, there are a lot of people doing these kind of things. So we intensify the follow-up. We're going to be doing a lot more testing, but we also appeal to the people of this country. This is not a Ministry of Health issue alone. The ministry can do what it can do, but the ministry cannot make you practice social distancing. People of this country must take their own, they must be responsible. They should participate. Otherwise, the government's efforts will not yield the results that we desire. If we say social distancing and people want to do things as they were doing before, and when there is local transmission and people blame the government for that, is it the government that has taken the virus from one person to the other? No. But we say if we know that it is communicable, we now know the routes of transmission. They say, let us stay away from each other, and people still want to socialize as nothing is happening. So I think the Gambians, we need to take the disease seriously. That's why we've been singing that we should not be complacent. COVID-19 is real, and you see it is on the increase if we do not practice social distancing. Let me give you an example. The locally infected, the local transmissions, most probably, if there were some social distancing, those two people who are family members of the fourth case wouldn't have had that disease. So that needs to be practiced. We need to answer, and we continue washing our hands. And we stay indoors when we have no business in being outside. I think we need to continue to practice this. Thank you. And it testing free what? The friend because you what? And ama fenka ama abeka friend because you testo. So anila test ke 1025 call. 1025 he call. It all ba lon na lebe minkala. E be alon na lebe nyini kala min ne ba lon na lebe step sol min tala puri se futa no testing dulato ese test ke test mu free let dawda banko beka ni e problem so the 1025 call and then ye futa je a test because you. Yeah.
One last question, final question.
The message still not to be getting to the average Gambians, because we have seen in the market Gambians are still gathering in the market, going about their own businesses. And also we have seen in the garages and campus or the booths. So what other awareness or what are other measures that are to be taken in order to keep the people in their houses open?
I think the message is actually getting to them. It is now for the people to react to that message in the interest of them, their families, of themselves, and the interest of the country. I don't think anybody, most of the people who sit in those booths now know what the government has been saying, what our people have been saying with regards to social distancing. It is just that they do not want to practice it. Now, we have a civilized country, and we have a democracy where the rule of law is respected, and we want, as a government, to act in a civilized way by encouraging people to do what they need to do. You have all seen what is being practiced in other countries. But our government says, let us talk to people, let them do what they need to do. And I think people should listen to that. But of course, if the cases are going to increase, if other people are going to put at high risk because some other people are refusing to practice what needs to be practiced, well, I think government probably will review that situation again and react accordingly. Thank you very much. Yeah.
Thank you
Good.
very much,
Yeah.
Minister. Thank you all. And as the Minister said, and the use of force is a last resort. We are following the due process. And people have been asking one question I would like to make clear. There are some citizens of the Gambia outside who wants to come back. I think there was already an announcement made that anybody coming from countries with confirmed cases, you have to be subject yourself to quarantine. Citizens of the Gambia, you have right to return. But it must be clear that you must subject yourself to quarantine. And then, as the Minister said, we are working. Yesterday we were at the border, so that's why we will not be in suits and comfortable, Nyeti Morso. We are working hard. Thank you very much and see you tomorrow. Thank you, Honorable Minister.
Thank you very much.
Thank you, Director Modunjai, and thank you, Dr. Vite and the team. Thank you all.
Thank you. Thank you all very much. Thank you. Yeah. Good.
Love like fire. Wow.
ngeen fan la skincare la 2020 lañ wax de waaw fii nag mooy Kerr fan Kerr zero tache perfect skincare saa su ne rek niñ ko dee defee rek loo lañ soxlaati rek maanaam bu ngeen am problème ci seen skin yéen xam ngeen fan la fii ngeen di ñëw suma xarit yeeg am di jàmm yi nga xam ne taas daf lañ sonaloon xam nga doon xeesal ba la ka xum éneew ma lañ ko nag waaye just in case comme ni ko gars yi defee rek en cas just in case loolu xew xam ngeen fi ngeen di ñëw skincare plus si baax rek la ñoo dox nag ay baax rek fu ne la ñoo dem ci réew mi di lañ indi rek nag products yu baax du Paris du Italie du USA du fi mu nekk nii sax boole nañ ci nag Sweden fu nekk lañ leen a indi les products bu dee tamit nag da nga ñuul rek ñu lay jamaa natural beauty that melanin dripping we do have stuff for you as well emuñ si skincare products rek ñu ngi ci cuub yi tamit fu ne la ñoo jaar in fact sax last commercial bi ñu defoon waxuñ leen woon ne dañoo dox ci ay kawar 9A grade rek nag waaw we do have bundles as well hair si lu ne la ñoo dox ñu ngi ci rafetal jigéen rek luy taaral jigéen rek waaw boo leen di tukki tamit bëggoon rek classic suitcase dañoo dox ci ay Samsonite duñ dee indi any brand of suitcases though other than Samsonite comme li ma dee wax rek boo eggee airport dëri Samsonite dafa am nuñ laa xoolee waaw ngeen de lan nag waaw skin ci moom la ñu gën a xamee nag skincare products ci moom la ñu gën a xamee ñu ngi dox tamit bentee tamit si ay dàlla man nag skincare mooy suma specialty xam nga rek jigéen bu sa xar kanam réglé loo def mu jag am nañ Patricia Reiner Kiwi Eye the whole range Lighten Up Gold Tomatine I mean the list can just go on and on and on and on lépp loo xam ne rek luy taaral jigéen la ci yooyu rek la ñoo dox skincare plus nag emuñ si Gambia rek ñu nga United States ñu ngi Gambia fii ba pare bu dee yaa ngi anywhere in Europe mun nañ la ko mail within 3 days rek ñetti fan rek nga jot say diw emuñ si loolu rek dañ laa consult tamit balaa ñu laa jaay diw dinañ def a free consultation pour wax la rek exactly li nga xam ne moo méngoo ak sa kanam dinañ leen wax tamit ne rek am nañ perfumes fragrances men's shirts accessories we do dresses as well we do blouses I mean we do shoes name it we do them Skincare Plus 2020 is our year of perfection zero task fi mu nekk nii réew mi fii kenn waratu fi task kenn waratu fi am problème kanam kenn waratu fi am problème picca boo ko amee dafa fekk ne rek ñëwuloo ci place bi fii
love like fire bring my yobo guma fanya love like fire
Stewart & Co. Solicitors, a legal excellence firm in London that can help you with all aspects of your legal work. If you are looking at immigrating to the United Kingdom, Stewart & Co. can help you to set up business, buy houses in the UK, and will deal with all your legal works from start to finish.
For all your general immigration work, we can help you with that as well. If you apply for any form of visa, whether student visas, settlement visas, marriage visas, or a child wanting to come to the United Kingdom to settle with the family, we can help you to achieve your goals.
Stewart & Co. Solicitors, a legal excellence firm specializing in conveyancing, immigration, litigation, family law, personal injury, licensing, no win, no fee. Contact us today at www.sk-solicitors.com.
No, ini bara. Okay. Welcome. Basically, lots of Lala Mialonko is cool, man, that I can really relax. What a madam? Yeah, that's what a madam? Yeah. Let me just that's right. Grand Villa. Kamu jadi Grand Villa. That's fine. Selamat. Yes. No. Yeah, actually, a lot of people are basically me alone because they relax. So it's basically like an amazing experience. Look at me, say what? Media, Nena Grand Villa is the best guest house in the Gambia.
Beji and the Grand Villa Guest House. Na labungul bebe senioring adum na bungul bebe nyarandiring coming ibela fila ila suwe taranyame. Intel Grand Villa na kiliano la lafino wala mukamoti intel kang. Na ye sabati Grand Villa yela kodo na fa kalamuta.
Oh man, this is like a paradise. I know. I so much love this place. Thank you. Trust me, I love this place.
You come to someone and you're watching one.
Yeah.
And you to Grand Villa.
I tell you, I love this place. Okay. I love this place, man. Oh yeah.
Ni lafta na kuo keso sotola. Futama Oljuntum Paradise Estate. Mbaya kumandiroke 7527-218. Wale futana website auto www.grandvillaguesthouse.com. Grand Villa Guest House.
Miss B Designer Outlet is the #1 quality and affordable stop shop for all your needs. Get your evening dresses, suit and ties, office wears for both ladies and gentlemen, beach wears, sport wears, pure leather shoes for men, quality belts, bags, heels for all beautiful ladies, original perfumes, accessories, and a lot more. Find us at Kololini Road opposite Gaddafi Mosque at the Aqua Bridge Station, or call us on 295-3411 or 764-2486. Miss B Designer Outlet. Shop right, look good.